a patient has treatment for skin cancer, and the treatment for skin cancer usually involves excision or removal of the skin cancer. And in my particular field, I specialize in facial plastic and reconstructive surgery. And so if a patient has skin cancer, for example, on their nose, I can remove that skin cancer. And my first goal is to make sure that the skin cancer is completely removed. After that, my focus becomes the cosmetic aspects of rebuilding that patient's nose. And so we'll call that a defect. A patient after skin cancer removal will have a defect on their face, in this particular case scenario, on their nose. The fascinating thing for me, what makes it very interesting for me to treat people with skin cancer, is that each one is unique. Each skin cancer is unique in the location, in the size of the defect that's left after the skin cancer removal. And so the reconstructive option is unique in every specific case. Generally speaking, I have two options to reconstruct a defect on the face. The first is a skin graft, the second is a skin flap. A skin graft is where tissue is completely removed from a donor site on a different part of the body, or on a location of the head or neck which is similar in skin texture, skin thickness, skin color to the recipient site or the defect, and the skin graft is trimmed, debulked, essentially cut into the new shape that it's going to become, and then I suture it or sew it into place, and it will then heal in that new location. A skin flap is where incisions are created around a particular defect, and the skin is undermined or lifted up from the tissue adjacent to the defect, and then it's rotated and advanced into place and sutured into its new location that way.